I being a nephrologist, so I deal with kidney diseases, and I am here to talk about certain common diseases which we encounter, which are related to the kidney. Unfortunately, the problem is that most of the people underrate the kidney. It is basically associated with excretion, that means elimination of waste products from our body. So most of the people talk about heart, lung, stomach, but very few people talk about kidney as an organ. We are concerned about the filters of our car in the form of air filters, fuel filters, oil filters to keep our car running and healthy. But we do not talk about the filters in our body, which is actually the kidney, which keeps our body healthy and fit. So today, my topics would be regarding the functioning of the kidney, the diseases which are associated with the kidney, that is kidney failure and end-stage disease, the risk factors, symptoms, and treatment which are associated with it, common kidney diseases which we encounter in our practice, and what we do in the wards. Like I said, kidney is an underrated organ, but definitely most of the people who encounter this, they understand the gravity of the situation which we have when we develop some kind of kidney failure. I'm sure amongst all the audience who are sitting there, quite a few of the people there would have encountered in their family, in their neighborhood, of people who have certain kidney ailments. To tell you about kidney diseases, actually, 1 in 10 people are affected with kidney diseases in our country. But quite a number of these problems go unnoticed because, one, there is lack of awareness. Second, like I said, being an underrated organ, we kind of feel that this problem is related to some other organ system. And so we kind of negate these symptoms and do not get ourselves checked up early in the disease, in which time frame this diseases can be kind of reversed, or maybe to some extent slowed down their progression. So let's discuss about the kidney. Kidneys are basically bean-shaped organs which are located at the back. The size of the kidney is the size of your wrist, and they weigh about 160 grams. The kidneys are basically made up of the functioning units, which are called nephrons, which in turn are made up of the filter, that is the glomerulus, and the tubules through which the urine formation occurs and excreted out. This is what is the function, the structure of a nephron. Here you can see this is the glomerulus, the main filtering unit. And once the blood is filtered, it passes through the tubules, leading to the formation of urine and finally excreted out. So basically, let's first talk about the functions. Like I said, it is associated with the removal of wastes and excess water from the body. You would be surprised that the kidney functions filters almost about 200 liters of blood, and almost 99% of this filtered blood is reabsorbed, and only 1%, that is almost about 2 liters of urine, is excreted out from our body in the whole 24 hours. This is the cut section of the kidney. You can see this is made up of various parts like the cortex, medulla, and then the tubules. So apart from the filtering function and excretory function, it has got certain important other functions like the formation of several hormones. Number one, the hormone renin, which regulates your blood pressures. So most of the time, a person who has got high blood pressure has some association with the kidney. Most of the times, people feel that blood pressure is related to the heart. But on the contrary, if you have blood pressure, then you should definitely get yourself evaluated for some underlying kidney function abnormality. So please remember, for a high blood pressure, you should consult a nephrologist and also take good care to preserve and control the blood pressure so that you can prevent further damage to the kidney. There is another hormone which is known as erythropoietin, which is associated with the production of red blood cells and the improving the hemoglobin of our body. Again, most of the times, people who have got low hemoglobin, which in our technical language we call anemia, people consider that there is some problem in the blood, but it is actually related to the kidney in most of the circumstances. So again, if you have anemia, you should get yourself evaluated for kidney function abnormality. Again, another very important hormone which is produced by the kidney is the activated form of vitamin D, which maintains the normal bone structure of your body. So if you have some bony pains, if you have certain osteoporosis, or you have got fractures, then again, you have to get yourself evaluated for any renal function or kidney function abnormality. What is kidney failure and what is end-stage renal disease? It occurs when the kidneys do not function properly or sufficiently, resulting in the accumulation of toxic and waste products in the body, which cause permanent and irreversible damage not only to the kidney, but other body structures as well, including the eyes, including the heart, including your gastrointestinal system, which is concerned with your appetite, which is associated with your digestion. It also causes damage to muscles and nerves, which leads to weakness of muscles, weakness of nerves, where you'll have body pains, you will have tingling and numbing sensation of your body. It is also associated with the bone metabolism, like I said, which causes weakness of bones and sometimes fractures. Also, in severe circumstances, it can affect your brain and also lead to certain permanent damages which can occur in the brain. And once the kidney functions go down below 20% of the required capacity, then the kidneys are unable to sustain life. And in those circumstances, we need certain treatments in the form of haemodialysis or transplantation. So, what are the risk factors which are associated with kidney diseases? Chronic diseases like diabetes, which is the most common cause of kidney diseases worldwide and also in our country. Hypertension is another important disease which can be associated with kidney damage. There are, in fact, you would be surprised that diabetes is most common in India, and India is actually known as the diabetes capital of the world. In fact, I was talking to a very senior nephrologist from Europe, and he had commented that I feel so small talking in front of people in a country where the total number of diabetic population is much more than the total population of my country. So you can understand the gravity of the situation in our country, which is associated with diabetes and its associated kidney diseases. The total number of diabetic kidney diseases in our country is probably many times more than the population of many countries in the world. So if you have diabetes, if you have hypertension, if you have a person in your family who has got diabetes or has got diabetic kidney disease, then you should get yourself evaluated and tested for any kidney-related problems. There are certain inflammatory diseases, what we call as vasculitis, rheumatoid arthritis, sarcoidosis, lupus, which can lead to kidney damage, blockage of urinary collecting system, which can be as a result of any infections, any stones, tumors. Prostate can also damage the kidney and lead to kidney failure. Chronic infections like tuberculosis, especially involving the kidneys and the bladder, are also associated with progression of kidney diseases. There are genetic disorders like polycystic kidney diseases, which are another causes of chronic kidney diseases. What are the symptoms which we encounter when a person has kidney disease? There is decreased amount of urine, यूरिन की मात्रा कम हो जाना, there is blood in the urine, यूरिन में blood आना, nausea and vomiting, vomiting की feeling होना और या साथ में vomiting होना, especially जब patient सुबह early morning में उठता है तब उसको ऐसा लगता है कि ब्रश करते समय मुझे vomiting की sensation हुई है. swollen hands, feet, हाथों पैरों में सूजन आना, मुंह पे सूजन आना, that is puffiness around the eyes, खुजली होना, itching, sleep disturbances. कई बार ऐसा होता है कि कई लोगों को बहुत ज्यादा नींद आती है और कई लोगों को बहुत कम नींद आती है. तो any kind of sleep disturbance which you notice in the normal in the change in the pattern of your sleep, you should report to the doctor and get yourself evaluated for kidney functions. High blood pressure is another symptom of kidney disease, and loss of appetite, yani bhook kam lagna. These are all symptoms which are associated with kidney diseases, and if you have any of these symptoms, you should not neglect them and get yourself evaluated. So आप ये देख सकते हो कि एक किडनी की वजह से कितने सारे सिम्टम्स होते हैं और अलग अलग तरह के सिम्टम्स होते हैं. सो कई बार तो ऐसा पता है कोई स्पेसिफिक किडनी का सिम्टम ना होते हुए भी पेशेंट को किडनी की बीमारी चल रही होती है, इस तरह के सिम्टम्स होते हैं और वो दूसरी चीजों का टेस्ट कराता रहता है और किडनी का टेस्ट कराना भूल जाता है. सो अगर आपको ये वाले सारे सिम्टम्स हैं तो किडनीज का टेस्ट कराना आपके लिए बहुत ज्यादा जरूरी हो जाता है. Now, once the creatinine rises above a particular level, then the body will not be able to function normally unless and until those toxins are removed from your body, either in the form of dialysis, which can be in the form of haemodialysis, that is blood related dialysis, or what we call as peritoneal dialysis, जिसको हम पेट वाला dialysis कहते हैं. The second definitive treatment modality is transplant. That is the best means of transplant for any patient who has got kidney failure, advanced kidney failure. So let's talk about these. Hemodialysis is a process by which the excess waste products and water are removed from the blood. It requires an access to the patient's bloodstream and the use of a machine which is known as hemodialysis machine. Now, this is basically how we get access to the patient's blood vessels. उसके लिए हमारे को एक फिस्टुला बनाना पड़ता है या ग्राफ्ट बनाना पड़ता है. ये आप उसमें फिगर देख सकते हो. ये सर्जिकल प्रोसीजर्स हैं. सो डायलिसिस से जाने से पहले आपको ये सर्जिकल प्रोसेस करा के आपकी नस को मजबूत करना होता है ताकि हम उसमें से ब्लड फ्लो ले सकें. एक होता है जिसमें हम आर्टिफिशियली एक ट्यूब डाल देते हैं जिसको हम कहते हैं ग्राफ्ट, और इसके अलावा से कुछ टेम्पररी कैथेटर्स होते हैं, पाइप्स होते हैं जो हम नसों में वेन्स में डाल के ब्लड को ड्रॉ करके उसको क्लीन कर सकते हैं. दिस इज अ डायग्राम ऑफ अ हेमोडायलिसिस मशीन in which the blood is drawn from the patient's body. It passes through the dialyzer, that is the artificial filter or kidney, and then it is again returned back. There are certain check systems here which can detect any kind of abnormalities, like अगर कुछ blood के flow में problem हो रही है या blood flow block हो रहा है या air जा रही है, तो इन सब मैकेनिज्म से जो इनके सिस्टम्स हैं, चेक सिस्टम्स जो हैं, इससे हम इन सारी प्रॉब्लम्स को दूर करके प्रॉपर तरीके से ब्लड को फिल्टर करके उसको वापस ब्लड में पहुंचा सकते हैं. हफ्ते में 3 बार और 3 से 5 घंटे का सेशन, यानी 12 से 15 घंटे का डायलिसिस का सेशन होना चाहिए हफ्ते में. तभी जाके हम किडनीज को नियर नॉर्मल पोजीशन में रख सकते हैं. बट उसकी एसोसिएटेड प्रॉब्लम्स होती हैं हीमोडायलिसिस की, बट वी कॉल एज वॉशआउट सिंड्रोम. इसमें मरीज अपने आप को बहुत ज्यादा कमजोर महसूस करता है, थकावट महसूस करता है. ये यूजुअली डायलिसिस के खत्म होने तक रहती है और कुछ समय बाद तक रह सकती है. इसकी एडवांटेजेस ये होती हैं कि पेशेंट अपने हॉस्पिटल में आके एक डायलिसिस सेंटर में आता है जहाँ पे स्टाफ उसका डायलिसिस करता है. उसको हफ्ते में 3 बार यहाँ पे आने की जरूरत पड़ती है। और वहाँ पे क्या होता है कि सारे के सारे एक रेगुलर आने वाले पेशेंट्स होते हैं, तो उसमें उनका रेगुलर कांटेक्ट डेवलप हो जाता है, आसपास के लोगों से उसकी जान पहचान बढ़ जाती है, और उसको एक अपनी तसल्ली मिलती है कि मेरे जैसे और भी कई लोग हैं। सो इनिशियली जो घबराहट, एक वो डिनायल होता है कि मुझे डायलिसिस नहीं करना, जब वो डायलिसिस यूनिट में जाता है, जब वो अपने जैसे बहुत सारे लोगों को देखता है जो कई कई समय से डायलिसिस करा रहे होते हैं, तब उसकी अपनी ताकत भी बढ़ जाती है। बट डायलिसिस के कुछ डिसएडवांटेजेस भी हैं, बिकॉज उसको रेगुलर हफ्ते में, सप्ताह में 3 बार उसको डायलिसिस में आना पड़ता है, ट्रैवल करके आना पड़ता है, उसके साथ किसी न किसी रिश्तेदार या दोस्त को साथ में आना पड़ता है, बार बार नीडल लगने से उसको पेन भी हो सकता है, और क्योंकि वो मशीन पे 4 घंटे रहता है तो इसलिए उस दौरान वो मूव भी नहीं कर सकता, और कुछ कुछ डाइट और फ्लूइड की रिस्ट्रिक्शंस होती हैं जो उसको फॉलो करनी है। तो उसके लिए एक हमारे पास दूसरा एक ऑप्शन होता है जिसको हम कहते हैं पेरिटोनियल डायलिसिस। पेरिटोनियल डायलिसिस में एक तरह का फ्लूइड जो है वो पेट में डाला जाता है, और कुछ समय तक इसको पेट में रख के और इसको बाहर ड्रेन आउट कर दिया जाता है। इसमें जो पेट की, यानी जो हमारा एब्डोमेन है, नॉट पेट, स्टमक नहीं, जो उसमें हमारे जो एब्डोमेन में स्पेस होती है जिसको हम कहते हैं पेरिटोनियल कैविटी, उसके जो झिल्ली होती है, दैट एक्ट्स एज अ फिल्टर, और उसके थ्रू जो है टॉक्सिन्स रिमूव हो जाते हैं ब्लड से। दो तरह के होते हैं, एक सीएपीडी, दैट इज कॉन्टिन्यूअस एम्बुलेटरी पेरिटोनियल डायलिसिस, जिसमें कि वो 4 एक्सचेंजेस करता है दिन में, जिसका जो नॉर्मली जो फ्लूइड डालने का समय और निकालने का समय जो होता है, उसमें लगभग उसको 40 से 45 मिनट का समय रहता है, लगता है। सो 4 बार अगर वो दिन में करता है तो लगभग उसको अपने लिए इस प्रोसीजर को करने के लिए हर बार 40 से 45 मिनट का समय अलग से निकालना पड़ता है। दूसरा एक होता है एपीडी, दैट इज ऑटोमेटेड पेरिटोनियल डायलिसिस, जो कि मशीन के थ्रू परफॉर्म होता है रात के समय जब पेशेंट सो रहा होता है, तो वो मशीन को कनेक्ट कर लेता है और वो मशीन पूरे रात जो है डायलिसिस का प्रोसेस करती है। इसके एडवांटेजेस ये हैं कि पेशेंट इसको खुद अपने से कर सकता है, अपने शेड्यूल के ऊपर कंट्रोल रख सकता है, डाइट और फ्लूइड की जो रिस्ट्रिक्शन जो हीमोडायलिसिस में ज्यादा होती हैं वो इसमें कम हो जाती है। ये एक तरह की कंटिन्यूअस थेरेपी है, यानी कंटिन्यूअसली हमारी बॉडी प्यूरिफाई हो रही है, तो इस वजह से ये बॉडी को ज्यादा स्टेबल रखती है और फिजिकल कंडीशन जो है वो बेहतर रहती है। इट इज ऑलमोस्ट सिमिलर टू हैविंग द ओरिजिनल किडनी, एंड इट प्रोवाइड्स लेस कार्डियोवास्कुलर इंस्टेबिलिटीज, यानी हार्ट के ऊपर दबाव कम पड़ता है, स्पेशली पेशेंट्स जिनमें कोई हार्ट की प्रॉब्लम होती है तो। बट इसके डिसएडवांटेज ये है कि इसमें मरीज को 4 एक्सचेंजेस दिन में करने पड़ते हैं। एक कैथेटर पेट के अंदर लगा रहता है जो कि परमानेंट रहता है। इसमें जो है बॉडी की जो इमेज है, यानी पेट का जो साइज है वो थोड़ा सा बढ़ जाता है। सो कई लोगों को कॉस्मेटिकली ये बहुत अच्छा नहीं लगता। इसमें इन्फेक्शन का बहुत रिस्क होता है अगर आपने इसको प्रॉपर तरीके से नहीं किया गया। अगर पेशेंट ऑटोमेटेड पेरिटोनियल डायलिसिस पे होता है तो उसको रात को अपने को मशीन लगानी पड़ती है, और इसके लिए उसको घर में स्पेस चाहिए होती है ताकि वो इसका जो सामान है, जो बैग्स हैं, उनको घर पे एक तरह से प्रॉपर तरीके से रख सके। नाउ लाइक आई सेड, जो सबसे डेफिनेटिव ट्रीटमेंट है दैट इज किडनी ट्रांसप्लांट, विच कैन बी आइदर फ्रॉम अ लिविंग रिलेटेड डोनर or from a brain dead person, and then this kidney is surgically placed into the body of the patient who has got kidney disease. Unfortunately, not all kidney failure patients are fit to undergo transplant. They have to go through a vigorous battery of tests to see whether they are fit to undergo transplant or not. That is because they have to use certain medicines which are known as immunosuppressants, which suppress the immunity of the body, which can worsen their general health. So even a transplant is not a definitive treatment for all patients. You have to have a very good physical fitness to undergo a kidney transplant. Advantages of kidney transplant is that the need of frequent dialysis is not there. Patients have a better quality of life, better health. The cost of their medical treatments go down, especially after the first year of transplant. There are no diet and fluid restrictions. And also, like I said, they provide less severe cardiovascular instabilities, especially in patients who have got underlying heart diseases. But to undergo a kidney transplant, we have to evaluate and we have to see that their hearts are stable so that they can take the load of a kidney transplant. The disadvantages of a kidney transplant is that following transplant, you need to make frequent visits to your nephrologist so that you can have your regular health checkups, regular tests to detect any problems which can arise in the transplanted kidney at an early stage. Pain and discomfort of surgery is a major deterrent for quite a number of people. There is always a chance of transplant rejection at all stages, whether it is an early stage or even at later stages. These patients, like I said, they are on certain medications which make them prone to infections, and they have to continue their medications lifelong. If any person who has undergone a kidney transplant stops his medications, there is a very high risk of rejection of that transplanted kidney. Now let's move to the common kidney diseases which we encounter. I have enumerated a few of them, like the polycystic kidney disease, hypertension, immunological disorders like glomerulonephritis, infections, that is urine infections, kidney stones, diabetic kidney disease, and analgesic kidney disease. Analgesics are common painkillers which we take, and they are associated with development of kidney diseases. Now let's talk about polycystic kidney. Then this is a condition which is genetically acquired, runs in the families. Usually females are carriers and males are sufferers, but it is not always true. Even females do suffer from this kind of a disease. There are two forms which are known as dominant and recessive. In the dominant polycystic form, one parent has the disease and passes it to the child. The chance of passing from one generation to the next is almost about 50%. So if you have a parent who has got a polycystic kidney, you have a 50% chance of developing that similar kind of a disease. Now, what are basically cysts? Cysts are abnormal pouches which are formed in the kidney. They eventually replace the normal kidney and they contain fluid which can get infected, leading to cyst infection, where could be the formation of stones, renal stones, and also there can be bleeding from these cysts. So, what are the signs and symptoms which we encounter in such patients who have polycystic kidney disease? There is a dull pain in the sides of the abdomen and back because of the enlarged size of the kidney. The kidney sizes may increase to 2 to 3 times the normal size of the kidney. There can be blood in the urine. There can be frequent urine infections. Like I said, उसमें blood आ सकता है, infections हो सकता है, stones बन सकते हैं, blood pressures बढ़ सकते हैं, और blood pressures जो हैं generally वो पहले ही बढ़ना शुरू हो जाते हैं before the cysts develop. It is not that a person is born with the cyst. It can form at any time during your lifetime, maybe at 15 years, maybe at 35 years, maybe at 50 years. So cyst formation can happen at any stage of your life. There can be upper abdominal discomfort because polycystic kidney में सिर्फ kidney ही affect नहीं होती, बाकी organs भी affect हो सकते हैं, जैसे कि liver और pancreas. So you can find cysts in the liver and the pancreas. There are certain other organ systems like the heart, brain, and even the intestines, which are also affected in polycystic kidney diseases. So what is the treatment? Number one, most important is blood pressure control. But अगर kidney failure develop हो जाता है, तो उनको supportive treatment देना पड़ता है until the time that the patient's kidney functions reduce to a level where dialysis or transplantation is required. Urinary tract infections are treated with the use of antibiotics. Pain should be managed with analgesics, but with a warning that the painkillers used should not be the ones which can damage the kidneys. There are certain painkillers which are safe for the kidney. So if you have a polycystic kidney disease, or if you have a person in your family who has got polycystic kidney disease, and if you have to take any kind of painkiller for any reason, then please take those painkillers which are safe for the kidney. Now, another important disease which we encounter in our clinical practice is the kidney disease, which is associated with blood pressure. That is hypertensive nephrosclerosis. Especially जिन लोगों में ब्लड प्रेशर कंट्रोल नहीं होता है, उन लोगों में इस चीज को डेवलप होने का बहुत ज्यादा चांस हो जाता है, which can lead to kidney failure. The symptoms usually are non-specific. पेशेंट कहेगा मुझे सर में दर्द हो रहा है, मुझे चक्कर आ रहे हैं, मुझे कोई नेक में डिस्कम्फर्ट हो रहा है, मुझे बहुत ज्यादा थकान हो रही है, मुझे नोजिया या वॉमिटिंग, दैट इज वॉमिटिंग की फीलिंग हो रही है या वॉमिटिंग हो रही है. सो ये वाले सिम्टम्स जनरली अगेन most of the times people will negate that it might be related to either some kind of neck problem, cervical spondylosis है मेरे को, उसकी वजह से हो रहा है, या मेरे को सर में दर्द है, मेरे को माइग्रेन है. सो उस वजह से वो पेशेंट्स जो हैं अपने आप को पूरा चेकअप नहीं कराते, और अर्ली स्टेजेस में इस तरह की बीमारी को कई बार पिक करने में दिक्कत होती है. मतलब दिक्कत क्या, पेशेंट आता ही नहीं है, तो कई बार अर्ली स्टेजेस में इस तरह की बीमारी डिटेक्ट ही नहीं होती है, और वो बहुत बाद लेटर स्टेजेस में डिटेक्ट होती है, जबकि किडनी डैमेज काफी ज्यादा हो जाता है और पेशाब में प्रोटीन आना शुरू हो जाता है. प्रोटीन इन द यूरिन which is manifested by a frothy urine. यूरिन में झाग आना. यूरिन में झाग आना एक ऐसा सिम्टम है जो कई बार हम निग्लेक्ट कर देते हैं. हम कहते हैं जब हमने यूरिन पास किया तो वो पॉट में गिरने के कारण झाग बने और वो तो फिर थोड़ी देर बाद चले गए, बट उस चीज को हमने निग्लेक्ट नहीं करना है और अपना इवैल्यूएशन कराना है. Treatment for hypertensive nephrosclerosis is again use of medications to control blood pressures, what we call as antihypertensive drugs, lowering of dietary salt. Salt intake को कम करना है, और जितना आप सॉल्ट लेते हो नॉर्मली 5 ग्राम पर डे रिक्वायर्ड होता है नॉर्मल इंडिविजुअल के लिए, बट उसको एग्जैक्टली आधा करना होता है अगर आपको ब्लड प्रेशर है या ब्लड प्रेशर से रिलेटेड किडनी प्रॉब्लम. Regular exercise is very important. Smoking, stopping of smoking, losing weight are other important lifestyle modifications which should be practiced अगर आपको blood pressure related kidney disease है. There are certain immunological disorders. Immunological disorders are those disorders which are concerned with the immunity of our body, and unfortunately they are not under our control. They are certain immune related diseases like glomerulonephritis or glomerulosclerosis, which are inflammatory conditions which affect the kidney. And most commonly जो हम encounter करते हैं उनके नाम बता देता हूँ. एक IgA nephropathy करके होती है जो सबसे ज्यादा common glomerulonephritis है. Streptococcal infections, generally कोई skin infection या throat infection के बाद कई बार ये disease सामने आती है, उभर कर आती है, और अगर हम इसको ट्रीट नहीं करते हैं तो ये चीज बढ़ के हमारी किडनी को पूरी तरह से डैमेज भी कर सकती है. सर्टेन ऑटो इम्यून डिजीजेस, जैसे मैंने आपको अर्ली स्टेजेस में बताया था, रूमेटॉइड आर्थराइटिस, ल्यूपस, सार्कोइडोसिस, ये कुछ ऐसी बीमारियां हैं जो कि किडनीज को इफेक्ट करती हैं. अगेन इनके सिम्टम्स भी बहुत नॉन स्पेसिफिक हैं. ब्लड, पेशाब में ब्लड आना, पेशाब में प्रोटीन आना, फ्रॉथी यूरिन जैसे मैं आपको बता रहा था, झाग आना which signify the presence of protein in the urine, dark colored urine और pink colored urine, that is again an indication कि उसमें blood जा रहा है. पैरों में सूजन आना. Then if you have certain systemic diseases like diabetes or autoimmune diseases, there can be other manifestations like weight loss, arthritis, joint pains, joint swellings और skin rashes. So अगर ये सारे सिम्टम्स भी हैं तो वो भी आपकी किडनी से रिलेटेड हो सकती है. इसका जो ट्रीटमेंट है, which again requires the use of certain medications which suppress your inflammation, like the use of steroids, medications to decrease excretion of urine protein, control of blood pressures, and certain dietary modifications are needed for the treatment of these disorders. Coming on to urinary tract infections. Urine infections are very commonly encountered in our clinical practice, not only in females, but also in males. It usually happens when there is an infection with the microorganisms, when they attach themselves to the urinary tract and begin to multiply. They may lead to infection of the kidneys, which we call as pyelonephritis, or infection of the bladder. And these can be a major cause for permanent kidney damage if these infections are left untreated. And like I said, women are more prone to get urinary tract infections, but there can be certain conditions when males are also affected, especially if there is an obstructed urine flow, which may be as a result of large prostate or stones. If there are certain abnormalities of the urinary tract, when in certain situations when a urinary catheter is needed. Urinary catheter is a tube which is inserted into your urinary system if somebody is either unable to pass urine or has certain abnormalities in passing urine. People who are diabetics are again more prone to urinary tract infections, and urinary tract infections are also increased in a pregnant lady. So, what are the signs and symptoms which are usually encountered in people who have got urinary tract infections? There could be painful urination, urine में जलन होगी, burning होगी. There will be foul smelling. Patients कहेंगे कि urine में से बहुत ज़्यादा बदबू आती है. Blood आता है urine में, बुखार आता है, ठंड के साथ chills, rigors आते हैं, दर्द होता है, पेट के नीचे हिस्से में दर्द होता है. There is increased frequency, यानी बार बार जाना पड़ता है, और यूरिन का पैसेज या यूरिन का जो प्रेशर है वो हम कंट्रोल नहीं कर पाते. साथ में वॉमिटिंग होती है या वॉमिटिंग की सेंसेशन. So इसके लिए यूजुअली जो ट्रीटमेंट है दैट इज द यूज ऑफ एंटीबायोटिक्स, appropriate antibiotics as per the culture sensitivity report, and drinking lot of water. Stones are important factors which cause kidney damage and also lead to permanent kidney disease like the chronic kidney disease. They usually start as crystals which usually precipitate out from urine, and usually these form when the substance in urine that prevents crystallization are ineffective. यानी इसमें ऐसा होता है कि जो स्टोन है वो एक छोटी कंकड़ी के माध्यम से शुरू होकर और बड़ा स्टोन बन जाता है. वेरियस फॉर्म्स ऑफ किडनी स्टोन्स आर देयर. मोस्ट कॉमनली जो हम इनकाउंटर करते हैं अपने प्रैक्टिस में वो कैल्शियम स्टोन्स होते हैं, which may be either in the form of calcium phosphate or oxalate stones. Males, usually 20 to 40 years of age groups, are the most commonly affected, and the most common reason for stone formation is drinking less water. Again, there are certain familial histories in which stone formation can occur. So if you have a family history of recurrent stone formation, then you should get yourself evaluated. क्या लक्षण होते हैं, क्या सिम्टम्स होते हैं? दर्द होता है जहां पे स्टोन है, स्पेशली जब स्टोन मूव करता है यूरेटर में जब वो पास हो रहा होता है तब वो दर्द करता है. यूरिन में ब्लड आ सकता है बिकॉज जब वो स्टोन मूव कर रहा होता है तो वो इंजरी करके ब्लड को यूरिन के साथ में निकाल सकता है. यूजुअली पेनफुल होती है जब हम यूरिन पास करते हैं, या कई बार मुश्किल से यूरिन पास होता है. अगर स्टोन बहुत बड़ा हो जाता है तो वो कई बार यूरिन के पैसेज को पूरी तरह से रोककर यूरिन को आना भी बंद कर देता है. So in those circumstances, you should drink plenty of water, especially if the stone is small, as a small stone can easily pass if you drink a lot of water. Painkillers, again, with a bit of caution that they should be kidney safe. Sometimes there are certain medications which can help in the breakdown of larger stones, but if the medications don't help, then we have to go for certain treatments like the shockwave therapy. अगर आपने लिथोट्रिप्सी का नाम सुना है तो वो एक हमारे मोडालिटी है जिसमें हम बड़े स्टोन को तोड़कर छोटा स्टोन करके फिर वो पैसेज के थ्रू निकल सकता है. Sometimes if the stones are very big, then cystoscopy or open surgery is needed. Now, I want to talk a little bit in detail about this problem, that is diabetes related kidney disease. Because like I said, इंडिया में डायबिटिक पॉपुलेशन बहुत ज्यादा है और डायबिटीज के मरीज को किसी ना किसी फॉर्म में किडनी डिजीज होने की संभावना बहुत ज्यादा हो जाती है, खासकर अगर आपकी फैमिली में किसी को डायबिटीज है या डायबिटीज से रिलेटेड किडनी डिजीज है. It usually occurs in patients who have got poorly controlled diabetes. Patients अपना डायबिटीज को चेक नहीं कराता है, उसकी अनकंट्रोल्ड शुगर्स रहती हैं और वो धीरे धीरे किडनीज को डैमेज करती है. उनका जो हमें एक HbA1c होता है जो 3 महीने का एवरेज शुगर होता है, वो हम जब कराते हैं तो वो बहुत ज्यादा बढ़ा हुआ होता है. हम उसको पॉइंट आउट करते हैं तो पेशेंट कहता है साहब ये तो बहुत समय से मेरी बढ़ी हुई है. तो वो एक निग्लेक्ट जो है वो सबसे ज्यादा डेंजरस चीज है, स्पेशली अगर हमारे को किडनीज का बचाव करके रखना है तो. डायबिटीज damages the blood vessels of the kidneys, and not only the kidneys, it also affects the eyes, brain, heart, nerves, and also the muscles of the body. जनरली अगर साथ में डायबिटीज के हाई ब्लड प्रेशर हो तो वो बहुत ज्यादा एक स्ट्रॉन्ग प्रिडिक्टर हो जाता है फॉर डेवलपमेंट ऑफ डायबिटिक किडनी डिजीज. एंड लाइक आई सेड, डायबिटीज इज द मोस्ट कॉमन कॉज ऑफ डेवलपिंग एंड स्टेज डिजीज, जहां पे हमारे को डायलिसिस या ट्रांसप्लांट की जरूरत पड़ती है. सो इसके क्या लक्षण होते हैं, डायबिटीज के क्या लक्षण होते हैं? सबसे पहले तो जैसे मैंने आपको शुरू में बताया, फ्रॉथी यूरिन यानी यूरिन में झाग आना, ये सबसे पहला सिम्टम होता है और यूजुअली पेशेंट इसको निग्लेक्ट कर देता है और बहुत लेटर स्टेजेस में जब ज्यादा हमारा जो टॉक्सिन्स हैं वो बढ़ने लगते हैं तब वो ब्लड टेस्ट में डिटेक्ट होते हैं. सूजन आना, स्पेशली जब बहुत ज्यादा देर तक वॉक करते हैं या बहुत ज्यादा लंबे समय तक खड़े रहते हैं तो सूजन आ जाती है. उस चीज को भी, उस सिम्टम को भी बहुत ज्यादा लोग निग्लेक्ट करते हैं कि साहब बहुत ज्यादा चले थे या बहुत ज्यादा देर खड़े रहने से तो हमारे पैरों में सूजन आ जाती है. हमारे क्या आती थी, हमारे तो आती है, हमारे तो पेरेंट्स को भी आती थी, हमारे तो चाचा को भी आती है, मामा को भी आती है. तो ये जो स्वेलिंग है ये आपको निग्लेक्ट नहीं करनी है. अपना ब्लड प्रेशर आपको रेगुलरली टाइम टू टाइम अपना चेक कराते रहना है, क्योंकि हाई ब्लड प्रेशर भी बहुत ज्यादा कॉमन सिम्टम है डायबिटीज के किडनी रिलेटेड. ब्लडी में शरीर में खुजली होना, नोजिया, वॉमिटिंग, वजन कम होना, थकावट होना या रात में पेशाब के लिए ज्यादा उठना, ये भी एक सिम्टम है. कई लोग इसको कहते हैं कि साहब हमारी उम्र की वजह से हमारे को रात को बहुत बार उठना पड़ता है या हमारे को प्रोस्टेट की प्रॉब्लम है इसलिए हमारे को रात को बहुत बार उठना पड़ता है. कई बार तो ऐसा होता है कि ये वाली प्रॉब्लम चल रही होती है और हम कुछ और चीजों को इवैल्यूएट करना शुरू कर देते हैं और किडनी डिजीज मिस हो जाती है. सो व्हाट इज द ट्रीटमेंट ऑफ this diabetic kidney disease? A good control of your blood sugar is very important. Sugar control रहना बहुत जरूरी है. HbA1c रेगुलर टाइम टू टाइम आपको कराते रहना चाहिए और उसको रेंज में रखना चाहिए. ब्लड प्रेशर को भी बहुत अच्छे से कंट्रोल करके रखना, स्पेशली blood pressure of less than 130/80 is what is desired in all people. There are certain medications which can decrease the protein excretion and thereby preserve the function of a kidney for much longer time. Lower protein diet. Let's talk about this factor because this is a very important factor. Most of the times people do that, they stop all kind of protein. सब बंद कर देंगे, दाल, पनीर, छोले, राजमा, चने. वो कहेंगे साहब हम तो सिर्फ घी या तोरी टिड्डा खा रहे हैं. तो ऐसा नहीं है. लोअर प्रोटीन डाइट का मतलब ये है कि वेजिटेरियन डाइट में जितनी हमारी प्रोटीन रिक्वायरमेंट है उतनी तो हमारी लेनी ही है. आप हर रोज ऐड देखते होंगे, कोई ना कोई फिल्म स्टार खड़ा हो जाता है और बोलता है कि हमारे को कितना प्रोटीन चाहिए हमारी बॉडी के लिए। जितना हमारा वजन है लगभग हमारे को उतना ग्राम प्रोटीन चाहिए। सो ये एक नॉर्मल पर्सन के लिए है, लेकिन जिसको किसी को किडनी की प्रॉब्लम है उसको अपने वजन का 80% प्रोटीन चाहिए। यानी अगर किसी का वजन 80 किलो है तो उसको दिन में 60 ग्राम प्रोटीन खाना अनिवार्य है, तब उसका बॉडी की हेल्थ मेंटेन रहेगी और किडनी के ऊपर भी लोड कम पड़ेगा। So you have to lower your protein diet, but please do not stop your protein intake. You should cut down on your non-vegetarian diet, and you should cut down on diets which are high, very high in protein, especially the natural supplements. अपना normal vegetarian diet लेते रहेंगे. Infections are very common in diabetics. So if you develop any kind of infection, please get those urinary infections treated, because infection can be a factor which can suddenly increase the worsening of kidney functions. Now, another important entity which we encounter in our clinical practice is associated with the use of painkillers. Most of the times हम अपने आस पड़ोस में देखते हैं, अपने दोस्तों में देखते हैं कि वो उसने बोला कि भाई मेरे को पेट में दर्द हुआ, सर में दर्द हुआ, पैर में दर्द हुआ, मैं अपने नियरेस्ट केमिस्ट के पास गया और मैंने पेन किलर की उससे गोली लेके मैं तो पिछले 5 दिन से रेगुलर पेन किलर खा रहा हूँ और मुझे तो बहुत ज्यादा आराम है. But you have to be very careful that painkillers are very, very dangerous for your kidney, and you can develop chronic kidney disease or permanent kidney damage if you consume painkillers, especially for a very long time. They are associated with conditions which require constant need of painkiller medications, and like I said, they can lead to severe kidney disease. Again, symptoms are the presence of blood in the urine, protein in the urine, and in very late stages, symptoms which are related to kidney failure, like I said, nausea, vomiting, कमजोरी, थकावट, सूजन और भूख कम हो जाना. So you have to be very careful to avoid long-term consumption of painkillers. Those already having kidney disease should refrain. They should not take painkillers, and if needed, they should always take safe painkillers which are safe for the kidney, especially in consultation with your doctor. So what do we do in the wards? Especially जब किसी को किडनी प्रॉब्लम होती है, we look for their vital signs, जैसे मैंने आपको बताया, blood pressure, temperature, heart rate, whether the patient is on catheter. Catheter जो मैंने बताया था यूरिन का पाइप होता है, डायलिसिस की उसको रिक्वायरमेंट है या नहीं है, कब है, कितने समय में है, और डायलिसिस के दौरान कुछ उसको दिक्कत परेशानी तो नहीं हो रही है. जो अदर हम टेस्ट करते हैं ब्लड से रिलेटेड, यूरिन से रिलेटेड, उसमें हमारे बॉडी के इलेक्ट्रोलाइट्स, सोडियम, पोटेशियम, सर्टेन टॉक्सिन्स जो यूरिया और क्रिएटिन, विच आर द मेजर मार्कर्स ऑफ किडनी फंक्शन टेस्ट, एंड ब्लड काउंट्स लाइक hemoglobin. So thank you gentlemen for your hearing, and I would like to take any questions. I'm sure ये इतना जबरदस्त मोनोलॉग था कि ज्यादातर लोग इस दौरान आई होप सोए ना हो, और जागकर अगर उन्होंने कुछ सीखा है, कुछ और जानकारी चाहते हैं, तो आई एम ऑलवेज देयर. So I have a question here from Mr. Garg. He says that the urine flow is slow in the daytime. I frequently go to pass urine in the night time. I have not got this checked so far because, however, I believe this is because of infection or so in the urinary tract or bladder. Rest, I don't have any problems, and I am 48 years of age. Yes, sir, you are absolutely right. You have certain symptoms which you should get yourself evaluated. You are most welcome to consult us here in the Apollo group, and I'm sure we would be definitely able to help you out. If your problems are especially in the early stages, I'm sure you will get benefit. So आप definitely आप एक बार अपना evaluations कराएं सब. That will be important for you. Right. Another question which I have here from Mr. Sudhir. He says that urine output is almost negligible, and he has a relative who's on dialysis. Why urine output is reduced after dialysis started? Although there is back pain in lower ribs near to backbone, what is the cause and treatment? Sir, with dialysis, the urine output reduces over a period of time. That is because whatever residual functions, although first and foremost हम डायलिसिस तभी शुरू करते हैं जब किडनी का फंक्शन 5 से 10% से भी कम रह जाता है, तो उसके बाद धीरे धीरे जो यूरिन की फिल्टरिंग कैपेसिटी है वो भी धीरे धीरे खत्म हो जाती है और यूरिन की मात्रा भी कम हो जाती है. बैक पेन जैसे आप बता रहे हैं, बैकबोन में जैसे आप बता रहे हैं, तो ये हो सकता है कि किडनी डिजीज से रिलेटेड जो मैंने आपको बोन की प्रॉब्लम्स बताई थी, ऑस्टियोपोरोसिस वगैरह डेवलप हो सकता है. दिस नीड्स इवैल्यूएशन एंड देयर आर सर्टेन थिंग्स व्हिच वी कैन यूज आफ्टर प्रॉपर इवैल्यूएशन फॉर द ट्रीटमेंट ऑफ सच काइंड ऑफ बैक पेन्स. सिम्प्टोमेटिक रिलीफ के लिए आप पेन किलर्स जो सेफ वाले होते हैं उनको ले सकते हैं, बट you should always get this evaluated, because अगर इस चीज को अभी evaluate नहीं करेंगे तो ये चीज ज्यादा और aggravate भी हो सकती है. Ideal creatinine level after dialysis, there is no ideal creatinine or urea level after dialysis. Normally what we expect is that if you are on thrice a week dialysis, that is 12 to 15 hours of dialysis in a week अगर आप करा रहे हैं, तो आपका डायलिसिस के बाद अगर आपका क्रिएटिन लेवल 5 से 7 के बीच में रहता है, तो दिस इज अ फेयरली good value of a creatinine level after dialysis, provided you don't have any other symptoms. Another question is that my wife has polycystic kidney since 2000. At the moment, she is in stage 5, creatinine on 10.3, potassium has shot up to 6.7, but it is now 3.6. She is not on dialysis yet. As a caregiver, managing diet is a big challenge. One says eat this and the other counter that. Very clear and specific dietary guidance is not available. Kindly suggest. Well, sir, you are right. She has a fairly advanced kidney disease with a creatinine of 10.3. Her kidney function is almost less than 5%. I don't have the details regarding her age and her weight, so I cannot give you a specific value of the kidney functionality. But definitely a creatinine of 10.3 is a very high level, which is associated with what we call as uremia. And as you yourself have written that the potassium had shot up and now it is being brought down to 3.6, I'm sure they must have used certain medications to bring it down. But she is at a stage where she would be needing dialysis. Actually, ideally speaking, she should be started on dialysis at this level. So we would suggest that you definitely get in touch with your nephrologist and get an access created as early as possible, because if there is immediate kind of requirement in the form of symptoms, then you would have to start her on dialysis immediately. Regarding diet, like I said, sir, eating this and eating that. See, you should be in touch with a renal nutritionist. They can guide you in terms of the proteins which you can consume and the proteins which you should not consume. Um, Unfortunately, in our country, we read mostly Western literature and follow those guidelines by the T. But in our Indian circumstances, like I said, the dietary requirements are very clear that if you are a vegetarian, you should just reduce your protein intake, but don't stop it completely. Try and avoid non-vegetarian food if you are non-vegetarian. Rest of the things, potassium restriction is again, like if your potassium was very high, there are certain uh, food products which have high potassium content. Those should be avoided, like juices, dry fruits, coconut water. And one thing which we very commonly do is using the rock salt, that is senda namak. They have a high potassium content instead of sodium content. But I would again suggest that you meet a renal nutritionist who basically deals with nutrition related to patients who have got kidney diseases, and they would be the right persons to guide you. Next question is related to a viewer's sister who has got rheumatoid arthritis, and she is taking tablets for this, which will it cause kidney disease? What should we do to avoid this? Right. Rheumatoid arthritis, again, per se, is one disease which can directly affect the kidneys. And also, the tablets which you take for rheumatoid arthritis are also implicated in causing kidney diseases. So, if you are taking certain tablets, please get in touch with your rheumatologist. Please meet a nephrologist who can get the evaluations done, because if you can pick up these things early in the course of the disease, you can prevent a lot of complications which can arise as a result of kidney damage, which may be associated with rheumatoid arthritis or medications which are being used for rheumatoid arthritis. Well, another question is there, in which they have asked a question: is there any technologically advanced fistula that does not protrude or hang out permanently? So fistula is a procedure in which nothing protrudes or hangs out. Fistula is a mere surgical connection between the artery and the vein, which are inside your body, and it is covered by the skin. So there is nothing artificially which is placed in a fistula. And the things which protrude or hang out permanently are catheters, which may be temporary catheters, which are used for a short duration till the time that fistula, permanent vascular access like a fistula, or a permacath, which is again a tubing which is placed near your neck, are placed. So fistula or a graft are things which do not protrude out or hang out from the body. But a catheter, temporary catheter, or a perm cath are ones which can hang out. Sleeplessness is becoming unmanageable. Need guidance. Definitely, sir. There are certain medications which we can use, which are safe to kind of overcome the sleeplessness. So I would suggest you consult your nephrologist, or you are most welcome to meet us, and we can help you out in this. Another question is related to a post-transplant patient who is 5 years post-transplant, feeling lethargic, fatigue, nausea, headache, and body pain sometimes. I would suggest that this person needs evaluation, because post-transplant 5 years, there are certain conditions which needs to be ruled out. There could be low hemoglobin, there could be high blood pressures, even over a period of time. Uh, calcium and phosphorus metabolisms are affected, which can lead to body pains and certain infections, and there are certain other conditions also which can lead to all these symptoms. So this person needs a thorough evaluation under a nephrologist. Another question here is how to reduce adverse effect of prescription medications on kidneys, which are painkillers proven safe for kidney. How to reduce adverse effect? Okay, same question. Uh, see, prescription medications are usually given for certain conditions with the intent of treating those particular problems or disease conditions which you have. Normally, prescription medications, once they are given, are associated with certain other adverse effects involving the kidneys. And I'm sure once these type of medications are being prescribed, your healthcare provider would be kind of informing you about the possible adverse effects of these medications on the kidneys. Apart from that, if you are taking medications related to diabetes, related to heart, related to hypertension, or if you are taking other medications like painkillers, or there are certain other immunosuppressants, then you should get yourself evaluated, get your kidney function test, get your urine routine evaluations done frequently, so that any kind of damage to the kidneys can be picked up early. The painkillers which are proven safe for the kidneys is the use of paracetamol, and there are certain opioid analgesics, opioid painkillers, which are usually not available over the counter. So please don't go and buy these medications on your own. Always take painkillers with a prescription from your doctor and take it for the period for which it is prescribed. Don't use it as a self-medication, and especially for a prolonged duration. Well, there's a comment which I would like to read out from Mrs. Sinha. She has thanked SecureNow for arranging this webinar on kidney disorders. And is this happening frequently so that she can subscribe to the channel and get more benefits and more help? Definitely, I'm sure the SecureNow will get in touch with you, ma'am, and they would be able to kind of help you out in these. Well, this is another question which we have received. Is creatinine level the only indicator of kidney disease? Especially since different methods, kits are being used for different diagnostic labs, which is the most definitive blood-based test for kidney? Yes, definitely. Kidney is the most important marker to determine the kidney health. Kidney creatinine is that value which will exactly show the exact functioning of the kidney. Based upon the creatinine values, your age and your weight, we can calculate the estimated GFR, which is nowadays being done by the labs with a particular cost. You can, there are certain app based, there are certain apps which have got formulas for calculating your estimated GFR. But then again, the most important marker is creatinine. Yes, there are different kits and there is different methodologies for determining the creatinine values. Your lab from where you are getting this tested definitely mentions the methodology which they have used for estimation of creatinine. Depending upon the methodology or kit, there is a reference range which is mentioned in the side of the value of your particular value, test value. So you have to corroborate with that reference value, and then you have to see how your creatinine value is. Very interesting question is regarding the drinking of ample water is good for general health kidney. Sir, like I said, your kidney filters about 200 liters of blood, out of which almost 99% is reabsorbed, and you produce almost about 2 liters of urine in a day. So, in order to maintain that healthy kidney and also to kind of supplement the water which we lose in terms of our normal metabolism, in terms of sweating, especially in a hot weather like we are having these days, and also for your body metabolism, over and above those 2 liters, you have to consume about 700 to a liter, depending upon your kind of activity, whether you're an outdoor person or whether you're an indoor person who is sitting in an AC. Depending upon that, you have to have about 2.5 to 3 liters of water for a general healthy kidney. This does not hold true for people who have got kidney diseases. They should drink water as advised by their nephrologist, depending upon their urine output. So I think if there are no more questions, we can end the session. I must thank everybody for this patient hearing. I hope it has benefited you in some form or the other. And with the questions which we got, I was kind of very happy that people have genuinely contributed to the interactive session which we had towards the end of the talk. Thank you very much.